Australia has had over 60,000 COVID-19 cases since the beginning of the pandemic. While New South Wales and Victoria share the dubious honour of hosting the longest lockdowns, other states have remained largely unaffected. In Queensland, even an outbreak of Delta hasn't managed to make any real dent in their case numbers. Here to explain why that may be and its implications for the rest of the nation is Associate Professor Linda Selvey, a public health physician and epidemiologist with the University of Queensland. Good afternoon. Welcome to the show.
Thank you, Dan.
Why do you think it is the case that there haven't been the kinds of outbreaks in Queensland that we've seen across the ACT, New South Wales, Victoria?
Well, I think it's many factors, and probably I definitely don't know all the answers. I guess the first one is a very strong border control, which means that we're having fewer incursions of the virus into Queensland, which means that it's less likely to take hold. Secondly, I think there was one cluster which I really did think was likely to go further. That was the what we're calling the Indooroopilly cluster, and that didn't. I think it was purely luck, really, that cluster occurred in a fairly well-off, middle-class kind of neighbourhood, where most people would be in secure work, so they didn't need to actually work, go to work even if they were supposed to be quarantined or isolating. It meant that people were generally well educated and more likely to be in a position to follow the restrictions closely. So I think that was, again, very much luck. It could well have, the incursion could have occurred elsewhere. I think another factor might be that we've paid a lot of attention to mask wearing now for a number of months. Since I think early June, we've been required to wear masks, and that was heavily policed earlier on. And I think people are, from what I've observed, people tend to be complying with that mask as well. So with the recent incursion in Logan, which we know we're not totally out of the woods yet on that one, but it may be that the mask wearing certainly helped reduce the risk of spread there. So there are a few reasons to say at least, Dan.
I wonder if you see any correlation between the weather. This latest outbreak in the east coast of Australia has been during winter. It's been very, very cold for parts. Do you see any correlation between weather and these outbreaks?
It is a bit hard to tell that, Dan. I think in a way we're in the perfect time in Queensland because at this point, because people tend to spend a lot of recreation time outdoors, in which case that would certainly help to reduce the risk of spread. Although we know from the New South Wales experience that's not, in and of itself just enough. Whereas in the peak of summer here, it can get pretty hot, so people tend to want to be inside, and in the southern states, so in winter, people are more likely to be inside than out. So that may also be a factor. I mean, we do know that there certainly have been large outbreaks of COVID in warmer climates, so warmth on its own isn't enough, but it may well be affecting people's lifestyles and how we're socialising.
Professor, there has been furious discussion about the borders and the point that you made at the very start about the quite strict border that Queensland has. So what's your perspective on getting that balance right?
Well, it is a tricky one, isn't it? I think many people in Queensland really appreciate the border restrictions because it's generally kept us pretty safe, and means that our lifestyles here, while not as they were pre-COVID, are certainly a lot less restricted than they are in the southern states. So, but of course there are these challenges of families not being able to unite and impact on workers and so on, which would be really, really difficult to handle. It's hard to see where you'd get that balance. I think previously, with previous outbreaks further south, it was possible to be a bit more lenient. I think the reason why our Premier and Chief Health Officer are so strict on the borders at the moment is for the obvious reasons of, the high transmission rates in New South Wales in particular, meaning that people coming in the border have a reasonably high probability of having the virus. yeah, I don't think there's an easy answer, but I understand why our strong border restrictions are in place right now.
No, I think you're absolutely right. And that's one of the really vexing questions among many. It's so good to hear lots of different perspectives as I think we're, as a nation, trying to navigate all of this. And on that front, we hear day in, day out, spruiking of the national plan. As an infectious diseases epidemiologist, I wonder if you think we've got the strategy right on COVID-19, and in particular on Delta.
Well, I think, clearly the key strategy of vaccination is really important, but I don't think that means that we don't do other control measures as well. And I don't think the modelling was ever intended to suggest that. So things like masks, good ventilation if possible, restricting still size of gatherings and so on, I think will be important even as we reach 70 or 80% vaccination coverage. And I think the other thing is that if the vaccination coverage is not uniform across the population, and it's likely to be so, if you have pockets in communities where there's much lower coverage, then that is a risk not only for the people in that community, but more broadly. So I think it's really, those blanket numbers on their own don't really tell us enough. I think we need a lot more detail about that vaccination coverage in order to be sure that we're getting to a point where we're safe.
On that point that you just made there around those other control measures, do we need to be having better national debates about what they are, and what do you think those conversations need to be?
Yes, well, I think the obvious things are such things as masks, which are relatively easy to implement and relatively cheap. I think it's a pity in a way that, while we've known about, we've been in COVID now for over a year, that we haven't really been paying a lot of attention to building design and ventilation design. And I think particularly in workplaces, where there's essential work going on, we really need to start paying more attention to retrofitting of buildings to improve the ventilation and so on. And that, while we're trying to stimulate the economy, that's a great thing to do. Like, that will employ a lot of people doing that, while at the same time helping to protect us against COVID into the future, but also any future respiratory viruses. So I think those types of things, again, it has to be coordinated really nationally. There would be a need for some national funding and support for that, for businesses and the like to do that. But I think that is really important.
There was a lot of debate as well around comments that were made by the Premier in your state, Anastasia Palaszczuk, about those aged under 12 and there really being a lack of modelling. Do you think that there was a point there to be made about just not having the information?
Yeah, I think the problem was that there wasn't really so much information. I guess there's two factors in relation to the young children. One is how sick they get. But secondly, the chances of them passing on the infection to others, which is probably the most critical thing at that kind of broader population level, whether the modelling needs to include that. And I think, it was clear that with other strains that children weren't such a risk to the population, but now it's a little less clear for the under 12s with the Delta strain and potentially future strains. So I do think, that's something that we have to just really watch closely the evidence and modify our approach accordingly.
Yeah, it's such an important point. Look, thank you so much for joining me this afternoon. Infectious diseases epidemiologist and public health physician, Associate Professor Linda Selvey. Wonderful to have you along.